Welcome to the Bronchiectasis and NTM Association podcast, where we're here to share valuable insight from leading health experts, heartwarming stories from people living with bronchiectasis and NTM lung disease, and the latest in health research and treatment. Please subscribe, follow us on social media, and visit bronchandntm.org to learn more. Just a quick note before we get started. This podcast series is intended for educational purposes only and is not suitable for medical advice. Please consult your medical provider if you have any questions. Welcome to today's episode where we dive into the crucial topic for anyone affected by bronchiectasis or NTM lung disease, and that is exacerbations. If you or someone you know is living with bronchiectasis or NTM lung disease, then understanding what an exacerbation is and how it can impact the daily life is going to be essential. In today's episode, we have gathered 5 frequently asked questions from our social group, Bronchiectasis and NTM 360 Social, as well as a Facebook support group. And joining us today to answer all of our questions, bronchiectasis and NTM lung related, is Dr. Aksamit, and he will share his insights and personal experiences in treating people living with bronchiectasis and NTM lung disease. So let's get into it. Let's get started. And of course, our first question has to be, what is a bronchiectasis exacerbation, and what are the common symptoms that indicate the worsening of your bronchiectasis?
It's great to be with you again, Alyssa, and this should be a really great session in that hopefully we'll address some of these very common occurrences. The first, of course, is what is an exacerbation or a flare? What that really refers to is a change in symptoms, feeling worse. And exactly what does that look like? That varies between patients for sure. There was a group of us, the better part of 5 or 10 years ago, that had a more formal definition of a change with increased cough, sputum, dyspnea, shortness of breath, fatigue, or even coughing up blood with a combination of those 3 or more, and then a change in management of this. So that, although was put together for research purposes, has a impact on what happens day in, day out. So most patients with bronchiectasis generally know when you feel unwell, and unwell more than just for a few minutes or an hour. Usually we say for a day or two, more than 48 hours. And then we can start thinking about what to do at that point. So feeling worse for a sustained period. Likewise, if you do happen to have that unusual or rare occurrence of coughing up blood, especially a lot of blood, we refer to as hemoptysis, then that should be dealt with immediately and not wait. You shouldn't wait a day or two.
So our second question is, what triggers a bronchiectasis exacerbation, and how can environmental factors like air quality or allergens affect people?
Yeah, so this is another great question. And much like so many aspects of bronchiectasis, this is a very diverse set of reasons to have problems. We call it heterogeneity. That is, lots of different contributing factors here. Sometimes it can be a viral illness, sometimes a bacterial illness, sometimes it be something, somebody gets a sinus infection or has a stomach or reflux problems that can bring this on. And then sometimes, as you suggest, the things that go on in our environment can also contribute. And we understand with lots of lung conditions, not only bronchiectasis, but in other instances of asthma and emphysema, but also in bronchiectasis, air quality, for example, can have a big impact. And whether there are wildfires or just increased levels of air pollution, all of those things can contribute to why we don't feel as well and have that constellation of symptoms that defines an exacerbation or puts us in a place that we're not used to being as far as our stable symptoms.
So, bronchiectasis exacerbations may not be directly related to environmental factors, but as Dr. Aksamit mentioned, many people do have other underlying lung conditions like COPD or asthma. So, with bronchiectasis, it's really important that you're still taking those types of precautions, like wearing an N95 mask if there is a lot of allergens or poor air quality outside, and just making sure that we keep in mind other factors that can cause exacerbations of pre-existing lung conditions. So, question number 3 is, how should patients monitor their symptoms and when should they seek medical attention?
Yeah, and this is another really great question. And this too varies between patients. And this is a great discussion to have with your providers at home. Some patients have been through exacerbations or flares enough that it's a similar type of sequence, and that doesn't take but a few hours or changes, and patients realize that they're going through another exacerbation, in which case to have a pre-specified plan with your provider on how best to approach this. Likewise, if you're not sure, sometimes you can give a call into the office and review things. But in most instances, it's a matter of understanding what those symptoms are and understanding when you're not feeling well, that probably is something that should be attended to and not dismissed.
So, another tool that would be useful to help you monitor your symptoms is called an incentive spirometer. So, an incentive spirometer is a device that you slowly inhale from. It doesn't have any medication, but it measures how much air you can fit into your lungs. So, to give you an example, if you have increased mucus, if you have increased inflammation, you're not going to be able to fit as much air into your lungs as if you were to be at your own baseline. It also helps to expand the lungs and fight against something called atelectasis. So, atelectasis essentially means that your lungs are sticking together towards the bottom. Now, this is very common and it happens when you're not as active, if you're sitting down, laying down, shallow breathing, really just not moving around the way that you normally would. And we know that when we start to feel sick, then we're not moving around as much. So using an incentive spirometer as a visual tool to see how your lungs are functioning. Another tool that is very beneficial for people is using a pulse oximeter. This is just good practice to know what your baseline is. And when you know what your baseline is, then if you notice that when you're feeling unwell, if you have a significant deviation from that level. So if you were 96 and all of a sudden you're 90, then that would be a conversation with your doctor, as well as if you are looking at your saturation and it's 88% or lower, that's a call to your doctor as well. My last tool I would suggest is a bronchiectasis action plan. And so this one can be found on bronchandntm.org under the Learn More tab and Downloads library. And this is a really good tool to help you have good communication with your provider, look at what your symptoms are, and create a plan for what you should do, when you should be seen, when you should call, what medication you should take, and how you should escalate your care when you start to feel an exacerbation. So now with all that, I want to bring you to our fourth question, which is, if prescribed medication, how would you actually know that your medication is working?
Yeah, and so in most instances, you know yourself better than anyone, and that we generally expect to have a response within the first few days. And if symptoms are getting worse and not better over that short period, even if they haven't gone away, that generally tells us that maybe we need to look into it a little bit further, and do we have the right reason for the exacerbation? And you hit it right on the nail as far as we need to oftentimes escalate our care. That is one of the characteristics of bronchiectasis, is this dilation of the bronchial tubes with cough and mucus, and that has a tendency to get worse. We know that, as you've heard on many of our other previous podcasts, that airway clearance is a hugely important issue, not only for maintenance, but in particular with exacerbations. So if you're on an airway clearance program once or twice or even 3 times a day, oftentimes during exacerbations, that may need to go up in frequency. So when patients come into the hospital, and I'll let Alyssa share with you her experience taking care of hospitalized patients and how much we intensify that airway clearance. And then once we're feeling better, can de-escalate back down. So it is a moving mark, and we have to adjust depending on how you're feeling. And how often were you doing those kinds of airway clearance with your patients, Alyssa, when you saw them in the hospital?
Yeah, that's a really good question, Dr. Aksamit. So, typically in a hospital setting, you'll have a respiratory therapist do a full assessment. So, they could look at your CT, your x ray, your vital signs. So, that includes your heart rate, your lung sounds, how much you're coughing, what color is your sputum or mucus, are you on antibiotics? So, they'll look at all of that and then they'll come up with a perfect plan for you. So, airway clearance can be several different things. It could be a flutter, an acapella, an OPEP, which are all handheld devices. It could be a huff cough, which is a coughing style to help you produce mucus. And then it could be a vest system or even a manual percussor, which is where we take an instrument and we run it up and down the back, the chest, the sides to help you loosen up that mucus and help you to cough it out. In the terms of frequency, that can be also different depending on a person's situation. So we might start off at 2 times a day or 3 times a day, 4 times a day, depending on what you do at home and the severity of what's going on. Or it could even be as much as every 4 hours while awake or every 4 hours around the clock. So meaning that we'll have to wake you up throughout the night to make sure that we're helping to loosen up that mucus and help you to get it out.
Yeah, and I might just add as one more point to emphasize, and you touched on this, is on the front end of this, what are those things that can help us understand, other than feeling worse and trying to pay attention to maybe oxygen levels? There are other monitoring devices, and for those techie folks with us, some are on watches that are very commonly worn that can actually measure your cough and the quantity of cough throughout the day, whether the sleep is more disrupted, whether or not there are other parameters that electronically can tell us what's going on. And just to put this all in perspective, as much as most of us embrace the technology and monitoring part of this, there was a recent study out in the last year just looking at sputum color and understanding that the darker the sputum color, the more likely there's infection present. And again, it's a very simple, but it's a common occurrence and can sometimes really give us some helpful information. So even the simple, less technically oriented changes in your symptoms or monitoring can be very helpful to help us make a decision on what's best next to do.
Would you ever give a patient a antibiotic and just say, if you see these signs and symptoms and you know you're having an exacerbation, you know how something always happens on a Friday after 5 o'clock when doctors' offices are closed.
Yeah.
Would you ever give a person an antibiotic on their file to take, or is it always recommended that they go in, have a sputum culture, and then get the antibiotics?
Yeah, this is another great question. I have this conversation all the time with patients, and then, again, each person is different. I can, especially if you've been through enough exacerbations, know what that sequence is. And if we start having them and understand what those germs are based on your sputum culture results, on what the best antibiotic might be to have on hand so that you don't have to try to get a hold of your provider or physician in the middle of the night on a weekend, that sort of thing, in this way. Having said that, we very often, when patients are having an exacerbation, want to collect a sputum. And if we start an antibiotic, if there's not a response, then look at that culture and make sure that we've got the right antibiotic. So it is a very fluid and a dynamic process to understand what's best. Many of us in this space, like to collect sputum not only when we're feeling well, but during an exacerbation so that we can optimize which antibiotic may be best. One caveat that I would oftentimes share with patients is if you're doing traveling at the domestic or especially in the international level, that's a conversation they have with your provider and your physician to whether you would want to take some antibiotic with you for your trip. It's tough enough when we're at home trying to get medical care if we have a flare, but if we're traveling, whether it's nationally or internationally in particular, sometimes those are things that be a little bit more proactive and be ready and accommodating to be able to deal with this. I also would encourage you that if you are traveling, not only would I consider to have that conversation about should I take an antibiotic with me just to have on hand, but also have a copy of your last clinic note from your provider. And if you can, even have images on a CD from your CT or a chest x-ray and microbiology, so that if and when you do need to see someone that's not familiar with your previous course, and they can understand where we're starting from, that can be very, very useful information, especially when you're on the road. So be prepared. Usually goes a long way in that situation.
And then our final question number 5, is what is the impact of exacerbation on a person's mental health? And how would you suggest people start to address that feeling if they are going through this and it's a hard time? We know that exacerbations can be both physically exhausting and emotionally exhausting.
Yeah, and that's for sure, it has a negative impact on our overall well-being. We understand that exacerbations accelerate loss of lung function, predict more exacerbations, and really result in poorer outcomes. The outcomes include, but certainly not the least of which, is our mental health. We understand that depression, anxiety, lots of other aspects of how we feel about things are really diminished when we have bronchiectasis, all of which is made worse during exacerbations just because of the disease burden that it creates. So to pay attention to that, to have a discussion with your providers if you're not feeling up to things, which is very, very common, and oftentimes needs to be treated either with medicines or even referrals at times, but it has a negative impact. So as you point out, be mindful of that. And if you find yourself being overwhelmed or starting to have that depression or anxiety creep back in, I would really encourage you to reach out to your provider, have that discussion. And that's something that we should be very proactive about, just because it's so very, very common and generally is the rule rather than the exception.
Yeah, health anxiety is something that is very common, especially when you have been in and out of the hospital and through many different doctors' offices. You know, being sick and going through that and feeling that you don't really have anybody to relate, especially when you're talking about bronchiectasis. Although it's not an extremely rare disease, it is something that you do find you don't know somebody else who has it. So with that being said, definitely seeking out support groups is going to be super beneficial. Talking to people, trying to get family members to understand what you're going through, and just having that support system that you feel that you can talk to and even that you can relate to.
And don't ever feel terrible if for some reason you need to be on some medicine for a period of time to help with your spirits to get through those very difficult and tender moments. Again, my experience is that this is probably the rule rather than the exception, and you shouldn't feel badly about that. And we're not superhuman in this way. And having these kinds of symptoms and underlying bronchiectasis can have a big impact on how we feel overall.
I would say, too, that fortunately there has been a shift in how we think about mental health and how we discuss health anxiety, especially since the COVID-19 pandemic. People are more openly talking about mental health and health anxiety, and really it's becoming more normalized. It's easier to seek support in many different ways depending on what you're going through, and your provider is here for you. And if you need that extra help, don't hesitate to ask for it. Many others are facing similar challenges. Dr. Aksamit, thank you so much for joining us today. Thank you for reviewing exacerbation symptoms and addressing the frequently asked questions that we get on our social media groups.
And glad to be here, and I wish everyone be well and take care of yourselves. It's worth the effort to do so. Thank you.
Thank you for tuning in to the Bronchiectasis and NTM Association podcast. We hope that you found today's episode helpful and inspiring. You can stay connected by joining our online community, following our social media, and visiting our website for more resources. And of course, subscribe to this podcast and join us next time for more insights, stories, and tips to help you live well with bronchiectasis and NTM lung disease. Until then, thanks for listening and be well.